your healthcare premiums may be going up 300% at the end of the month as the rest of government is shut down, as Kristi Noem's goons wander the streets of Chicago and Portland. They keep putting people, often American citizens, in the hospital. I'm going to explain why the current conception of the primary focus on shutdown is misconceived.
I don't know what the they're talking about, to be honest.
Right-wingers claim that Democrats have shut down government.
I apologize for swearing.
Because they want to give health care to, as they call it,
illegal aliens.
Now, that ignores the impoundment rescission issue, but let's take that at its word.
Unauthorized immigrants aren't eligible for ACA
yes,
benefits.
It does. It says very simply they want to repeal the changes that we made.
They make that claim based on two issues.
Very often somebody who's there in the emergency room waiting is an illegal alien.
First of those is that if you are anybody in America and you show up in an emergency room and you need care, you'll get care. So if you happen to be undocumented, you'll still get care. J.D. Vance suggested that you should be able to sniff out the illegals.
We believe that the American people's government exists for the American people.
Based on who knows what.
Very often a person who can't even speak English.
Maybe just your accent, and deny them care that way.
Why do those people get health care benefits at hospitals paid for by American citizens?
A very, very Catholic proposition, let me tell you.
Someone who says that I'm against abortion, but I'm in agreement with the inhuman treatment of immigrants who are in the United States. I don't know if that's pro-life.
But of course, that's EMTALA.
The Emergency Medical Treatment and Labor Act. That policy requires any hospital that receives Medicare funding to treat anyone who comes into an emergency room, regardless of immigration status or ability to pay.
That is a law passed under Ronald Reagan.
Now, one of the reasons for this is that if someone comes to the emergency room with life-threatening injuries, they need to be stabilized immediately. And if the hospital were to withhold care to check for their immigration status, they could die.
It's still in place.
Already, nearly 100 rural hospitals have closed or eliminated inpatient services in the last decade, threatening healthcare access to some of the more than 16 million people living in rural communities who rely on Medicaid.
The issue is how much free medical care emergency rooms have to provide.
While the full impact of Medicaid cuts can take years to unfold, doctors tell us the system is already buckling. The closure of the hospitals here.
And how much that undermines hospitals, particularly rural ones.
It's not just a loss of care, it's actually a loss of life.
The second basis for their claim that Democrats want to
reward illegal aliens
is based on something Democrats are trying to do to reverse what happened under the big ugly bill.
They're just trying to come up with any excuse for them to essentially have a reason to increase the premiums on 24 million Americans that are going to double starting November 1st.
And that is that there are legal immigrants to the United States,
other non-citizens,
whether they have valid asylum claims, whether they have parole, whether they have another kind of protection that allows them to stay in the country. And they were able to qualify for certain kinds of medical care, and Republicans took that away in the big ugly bill, and Democrats want to replace that.
They want to repeal the changes that we made in the Working Families Tax Cut, the One Big Beautiful Bill. And
Mike Johnson likes to lie about this one a lot.
Go to speaker.gov and see it for yourself.
Now, in fact, one of the things Republicans are trying to do is obscure one of the main asks, and one of the asks that will become increasingly urgent as the month goes on, so long as the shutdown happens, and that is the ACA subsidies.
What will happen if these enhanced premium tax credits are not extended by Congress is that millions of people are going to log on to healthcare.gov or their state's marketplace, and they're going to see that their premiums for next year are doubling.
The Obamacare subsidies that make healthcare, health insurance affordable for middle-class people who don't otherwise qualify for the Medicaid that you would get through Obamacare.
What we're looking at are people who buy their own health insurance coverage.
Those subsidies, a big chunk of them were cut in the big ugly bill. And that means that for people who rely on ACA, on Obamacare, they will be getting notice by the end of the month that their premiums are going to go up sometimes as much as 300%. And, well, I've been on the record since 2009 that Obamacare has this kind of cost built in it. Nevertheless,
about 22 million people are getting one of these enhanced tax credits right now, and their premium costs would double on average or more, maybe.
A number of Republicans know that they're sunk, that they need to find some way to extend these subsidies because too many of their constituents rely on them. One thing that we know is that rural people, especially farmers, something like 27% of farmers rely on Obamacare.
small business owners, farmers and ranchers, other people who work at small companies that don't offer health insurance.
Add that to the stress on rural hospitals that the Big Ugly Bill already put into place, again, with Medicaid reimbursement.
So many closures affecting communities and many more cuts expected after the 2026 midterm elections.
You've got healthcare becoming less accessible to the very same farmers who are losing their agricultural markets in China to Brazil and Argentina. Most people, 61% of the country, doesn't yet understand that their ACA premiums are about to go up. 61% don't understand that. Most people who aren't really deep into politics don't even understand this healthcare divide. But for those who are asked, do you want to keep your ACA subsidies? Even 57% of MAGAT Republicans do, and something like 78% of the country as a whole. There is overwhelming support to extend those subsidies, and that is one of the big asks from Democrats, and Republicans are trying to obscure that. But there's another cost. There's another kind of quote unquote free medical care that quote unquote
illegal aliens
are getting, and it needs to be part of the equation. And that is the cost of paying for the damage that Kristi Noem's goons are doing. This was made exceptionally clear in a habeas petition that came public in the last couple of days. A guy by the name of Ovidio Marin, Baron Ovidio Marin, who was working at a car wash in Carson, California on August 27th. And Customs and Border Patrol raided the car wash. They detained him and in the process broke his leg so badly he has been in the hospital since then. It was 37 days when the judge issued the ruling. It's at another couple of days. Most of the details of this are still sealed because it's a habeas petition, but the judge issued a ruling saying you got to let this guy out of quote unquote custody. But what she means by custody, so he's still in the hospital, Harbor UCLA Hospital, is that he has had uniformed guards 24/7 for the entire period that he has been in the hospital. Let me repeat that. DHS has been paying a company called Spectrum Detention for 2 to 4 uniformed guards since he was first detained in the hospital. They do not yet have a warrant against him. They have not claimed that he is undocumented. In fact, they've been interviewing him while he's been on medicine without attorneys. They've been impeding his access to his attorneys. He has been handcuffed to his hospital bed. They have been surveilling him as he goes to the bathroom. 37 days in a hospital with 2 guards. I did the math on what this would cost. And the guards at the lowest amount, no overtime, would cost about $71,000. This is per GSA, per what we know the government is paying. And then if you take kind of a low rate for a daily just bed in a UCLA hospital, that's $9,000 times 37, so $333,000. So that one guy that Kristi Noem's goons brutalized, probably $400,000 that taxpayers are having to pay. And he may well be an American citizen or a green card holder. It's not even clear he's undocumented, but we are paying his hospital costs because Kristi Noem's goons destroyed his leg.
They call themselves ICE people, which I don't believe they are ICE people.
There's an even more important case of this. The 79-year-old car wash owner who tried to ask the goons, what evidence do you have to come and steal my workers, to come and kidnap my workers? DHS tackled the guy, 79-year-old, put him in the hospital, waited 12 hours. He's a U.S. citizen. They knew that very quickly.
I have a heart condition. 3 big people were sitting on my back, the way they tore me down, sitting on me, and I asked them to let me go, which they absolutely would not pay no attention.
Waited 12 hours before they actually gave him medical care. And now he's suing for $50 million because of the damage that they did to him in this raid.
ICE and DHS violated their policies that day. They violated the United States Constitution, and they violated California state law. And we feel very confident that we're going to be able to achieve justice for Rafi Shuhed in a court of law.
So multiply this. And one of the things about the guy from Carson, Ovidio Marin, is that they hid him. They put him in the hospital under a secret name. So it took a while to even find him. How many other people are being held under these blackout, that's what it's called by DHS, under blackout conditions, under law enforcement claims when there's not even a warrant for this person's detention? And we don't know about. What we do know is Republicans are lying when they say that Democrats want to give illegals free health care.
And since this is the last speech that I will give as president, I think it's fitting to leave one final thought, an observation about a country which I love.
They're lying about a law that Ronald Reagan passed.
Anyone from any corner of the earth can come to live in America and become an American.
They're lying about the status of people who would otherwise have been able to access certain kinds of health care until it was cut out in the big ugly bill.
Other countries may seek to compete with us, but in one vital area, as a beacon of freedom and opportunity that draws the people of the world, no country on earth comes close.
They're trying to distract from the fact that your healthcare premiums may be going up 300% at the end of the month, and they don't want to do anything about that. But they're also hiding the fact that as the rest of government is shut down, as Kristi Noem's goons wander the streets of Chicago and Portland, they keep doing this to people, often American citizens, and putting them in the hospital. And so whereas you used to get premiums to help you support your health care, whereas some legal immigrants used to be able to get health care, which, by the way, helps the hospital survive, there's another cost we're not accounting for.
Thanks to each wave of new arrivals to this land of opportunity, we're a nation forever young, forever bursting with energy and new ideas.
And that is the cost of the damage that Kristi Noem's goons are doing to both undocumented and American citizens and sticking them in the hospital for long periods of time.